The third edition of the Ritshidze Report has revealed that most Northwest clinics are running low on supplies. Now, this after data was compared over the past 3 years following community meetings in areas such as Mahikeng. For more on these findings, we are joined by Ritshidze Project Coordinator Ndivhuwo Rambau. Ndivhuwo, thank you so much for joining us this evening. Now, this data on the effectiveness of healthcare institutions focusing on HIV and AIDS as well as TB for the third edition in terms of this Ritshidze report, where was it collated from?
So we do quarterly monitoring in Ritshidze, and in the Northwest we monitor 28 facilities, including 10 in the Jana La Platinum, 8 in Dr. Kenneth Kaunda, and 10 in Nagamudiri Mulema.
And what would you say are some of the most alarming findings out of this report?
So when we look at issues of our ARV collection, we know that one strategy to reduce waiting times and ease congestion is for people to actually collect the longer supplies of medication. So this would simply mean that you have less trips back to the clinic going to collect your treatment. But unfortunately, only 21% of people living with HIV that we spoke to reported that they receive a 3 to 6 month out refill, compared to 64% in Mpumalanga, which is the best performing province across Ritshidze monitoring.
And what would you then say would be the long-term effect on patients who have got a time lag of 3 to 6 months in terms of them getting their ARVs?
So, in us saying that people living with HIV should get a longer ARV refill, it actually helps in decongesting the facility. So where patients don't need to necessarily keep on going back to the clinic, it means that we decongest the clinic. It means that people won't keep going to the clinic just to collect their treatment, and rather you'll be going to the clinic because you are sick. And when we look at issues of waiting times, we found that on average people still spend about 4 hours waiting in the facility, and the average waiting time was over 4 hours at 29% of the facilities that we monitored. And in most instances, people stated that spending so much time at the facility was a major source of dissatisfaction as well.
I mean, the report also speaks on stigmatization. Just speak to us there, especially when it comes to the LGBTQ communities, sex workers, and drug users.
So when it comes to key pops, only 30% of trans people say that the clinic staff were always friendly and professional. And even the testimonies that were given by key pops on the day of the accountability meeting showed that there is quite a lot of stigma and discrimination against key populations. And when we asked if there are specific services for key pops, so hormone replacement therapy for trans people, if there's any drug dependency supported facilities, we find that these services are hardly ever available. And even when we look at HIV prevention tools like condoms and lubricants, they should be freely available at facilities, but we were only able to find them at 25% of the sites that we monitored. And when we look at PrEP as well, it's reported to be available at all facilities, but it's hardly ever offered to key population as an effective HIV prevention tool.
Now, the report was presented to the community of Mahikeng yesterday, I believe. What were the sentiments coming from the people of Mahikeng, given that the Northwest province has proven to be the worst performing province?
So in terms of community members and, people coming from the different sectors of the PLHIV sector, for example, from civil society, community members are saying, let's actually work together with the department to ensure that we improve the healthcare system in the province. It's not to just say that, nurses or the department is to blame only, but we want to work together with the department as the PLHIV sector to say, let's work together, let's implement the recommendations to ensure that we actually build the healthcare system, to ensure that we don't leave anyone behind in terms of treatment, in terms of HIV testing, in terms of actually getting people and retaining people on treatment as well.
Ndivhuwo, thank you so much for your time this evening. A very interesting report and some of the outcomes coming from there. That is Ndivhuwo Rambau from Ritshidze, the project coordinator, speaking to us there about the 3rd edition Ritshidze Report. Now